Your health insurance changed, even canceled without your permission. On News Center 7, I-Team uncovered it happened to families in the Miami Valley and hundreds of thousands across the country. The I-Team's John Bedell looks at how rogue insurance agents made millions by taking advantage of consumers and your tax dollars.
Lori and Randy Delaney say a rogue insurance broker treated their health care like a pinball, bouncing them around from one insurance plan to another to make money.
And they're like, yep, you got coverage, but it's with United Healthcare. I'm like, how is it with United Healthcare? I put it back to Medical Mutual. Why is it with United Healthcare?
They got an Affordable Care Act plan, but a trip to the pharmacy to pick up Randy's insulin for his diabetes was the first sign something was wrong.
And when I got to the pharmacy, you can imagine my shock when they told us it was $1,096. I was like, what?
A broker in Texas had enrolled Lori and Randy in a new plan without their knowledge. The I-Team has talked with people across the country who've had their health insurance hijacked.
It's stressful and it's scary and it's embarrassing because you have them looking back at you like, you know, why are you giving us this card saying that you're covered and you're not again?
Tisha Foreman says the first sign of trouble for her was when her daughter's pediatrician thought the family had no insurance. She later found out she had several policies at the same time after brokers she never met enrolled her.
For 3 months, I kept calling on the phone, trying to talk to the marketplace to get them to understand it. I wasn't doing these applications. I didn't know who this agent was.
This class action lawsuit claims families who rely on the Affordable Care Act marketplace for health care are victims of a multi-million-dollar health insurance fraud scheme. The companies named in the lawsuit have denied wrongdoing.
I believe this is the largest health insurance fraud case ever.
Attorney Jason Doss says rogue insurance agents exploited a provision added during COVID to let low-income Americans switch their coverage at any time, not just during open enrollment.
The problem is that what if the bad guy owns the enrollment platform? They have the keys to the castle.
If insurance agents switch your ACA plan, they make money. A monthly commission of about $20 per policy.
All they need is a first name, last name, date of birth, and state.
Insurance agent Callie Navardies says her clients kept getting switched without her knowledge.
Over and over and over again, and like a dozen times with just one person, like one client.
The lawsuit says they got her clients' information using pop-up ads like this, advertising free money. Many customers thought they were just requesting information, but got signed up for health coverage instead. The federal government says between January and August, nearly 275,000 people complained they were changed from or enrolled in plans without their consent. Each switch meant potential gaps in their health insurance coverage.
It's just like somebody's in there just messing with your life every day.
The feds have now suspended 850 agents and brokers for reasonable suspicion of fraudulent or abusive conduct related to unauthorized enrollments or plan switches. Since the lawsuit, any new agent on a policy has to conduct a three-way call with the marketplace and the customer. Lori and Randy said their plan became such a hassle and so expensive, they're now going without health insurance until December 1st, when Lori's insurance kicks in from her new job.
But I also want to be an advocate for other people to help them navigate through this awful process with Marketplace.
And the I-Team's John Bedell joins us live. John, Lori told you she's afraid that this hassle is not over.
That's right, James, because even after their new insurance kicks in with Lori's job, they could get a surprise bill during tax season. Lori told me that rogue insurance broker incorrectly adjusted their income several times, and that can trigger IRS penalties of thousands of dollars, and Lori's worried they're going to end up having to fight that, too.
All right, John, keep us posted. John Bedell live for us this afternoon. And in a statement, the Centers for Medicare and Medicaid Services told the I-Team protecting the millions of people served by CMS programs remains the agency's top priority. CMS continues to leverage a broad array of resources to warn FFM consumers about potentially fraudulent agent or broker activity and misleading marketing websites. You can read the agency's entire statement on WHIO.